Preterm ovarian hyperstimulation is a self-limiting condition and resolved spontaneously without treatment, characterized by prematurity, vulvar swelling, elevated estradiol gonadotropin levels, and ovarian cyst.
So ovarian hyperstimulation syndrome is when the ovaries begin to, and it's really triggered by the HCG exposure. The HCG, which we use to trigger the final maturation, and if the patient is pregnant, HCG is produced by the pregnancy a few days or a week later. It affects the ovaries in such a way through generation of some vascular endothelial growth factors to start leaking fluid. And what happens, the ovaries become very large and they exude fluid into the peritoneal cavity, into the abdomen. What a woman feels is that she's very bloated, the ovaries are very large, there is fluid accumulation in the pelvis and the abdomen, sometimes even in the chest. That is painful, that is uncomfortable. Women usually complain of shortness of breath, epigastric pain in the stomach area, and it's all because of accumulation of large amount of fluid. The other dangerous thing about that's the discomfort, of course. The other thing is that there are fluid shifts, and the patient actually may have a lot of fluid in her abdomen, but not enough in her vascular system. So women are at risk for blood clots and electrolyte imbalances. So it is a very serious situation. Women who are at most risk for this syndrome are women with PCOS condition, and particularly women with PCOS condition who are slender. It's an interesting inverse relationship that heavier PCOS women are at lower risk. They are at some risk, but at lower risk than the slender women with irregular menses and PCOS symptomatology. Younger women, of course, are at higher risk for this syndrome because an older woman doesn't produce as many eggs or as high of an estrogen level. She would be at low risk for OHSS in that setting.
Application in medicine. Ovarian hyperstimulation syndrome is a rare disease among preterm infants. Genitalia swelling are abnormal in neonates. Hyperstimulation syndrome should be considered as a diagnosis in preterm infants with external genital edema, which might extend up to the upper legs and hypogastric area.
Women who use fertility medications, particularly those drugs that stimulate multiple follicles to develop, are at risk of a disorder called ovarian hyperstimulation syndrome, also known as OHSS. OHSS is the result of stimulation of the ovaries with medications. It doesn't happen in very many people, but it can occur in up to 5% of women to a significant degree. In a small portion of those women, hospitalization is required. The medications used for ovarian hyperstimulation cause the ovaries to become leaky. Sometimes fluid will exude from the ovarian tissue into the pelvic cavity, causing women to fill up with fluid in their abdomen. Sometimes that fluid can actually travel up to the spaces outside the lungs and cause difficulty with breathing. These are only, however, in the most severe cases. Ovarian hyperstimulation syndrome is often preventable. If a reproductive endocrinologist is monitoring the cycle very carefully, looking at blood estrogen levels and ultrasound examinations during the stimulation cycle, that doctor can often prevent OHSS from occurring. Some women are much more prone to OHSS than others. For example, young women, women with lots of follicles, for example, women with polycystic ovary syndrome, are the ones who are most susceptible to OHSS. Should OHSS occur, the treatment is usually just supportive care. In other words, the disorder always goes away by itself. However, the symptoms can be very difficult, and in most severe cases, it can be life-threatening. In severe cases, women might have to be hospitalized and receive intravenous fluids. In some cases, a needle is placed into the abdominal cavity and liters of fluid extracted. This can help the patient feel like she can breathe more easily and urinate more easily. Ovarian hyperstimulation syndrome occurs in many women. However, it is only severe in a small minority. A good reproductive endocrinologist who is board certified and trained in the management of fertility patients and ovarian hyperstimulation syndrome is required to avoid the complications of this disorder.
Pros and cons. Pros. It's not difficult to diagnose. It's not a lethal disease. Cons. The baby feels discomfort, doesn't need surgery. Conclusion. In preterm female infants who present with genital edema, hyperstimulation syndrome should be considered. The presence of ovarian cysts in sonography aids in diagnosis of this syndrome, and gonadotropin as well as estrogen levels might be increased. This syndrome is usually self-limiting and doesn't need pharmaceutical or surgical treatments. Thank you.